And happy Friday for those who are streaming right now live from Dr. Munné's headquarters here in downtown, the Museum District. Welcome to all of you. We just want to say we appreciate that you are connecting. Today, we are starting a new series called Implants. It's going to have so much interesting information and that you've been looking for. You will have hopefully all the answers after this series. Dr. Munez is going to illustrate us, explain us, walk us through the process and everything. Thank you so much, and let's get started. Thank you, Dr. Munez.
Good morning, Adrian.
Good
Good morning,
morning.
everyone. Another Friday. The week goes so fast right here. Coffee.
Coffee with Dr.
To
Munez.
get us started and definitely start the weekend in a good note. I'm going to toast to that.
Yes, exactly.
But I think that we're going to start this series on implants because nowadays there's a lot of interest on implants, and I think that there's also a lot of misinformation, and I want to make sure that our audience gets educated and that we are a source of education for the community, and just teach you about dental implants. And I know that there's a lot of information out there, some good, some not so good, but we'll also be reviewing some cases that we've done and some patients. And today is just going to be an introductory series, so but we're going to dig deep into that. So I just want to clarify to begin with some concepts so everybody understands what a dental implant. And if you go ahead and research implants, and Google it, sometimes it comes up like all kinds of implants, right? You know, uh, knee implants, breast implants, all kinds of implants. So we're talking about dental implants, and basically, an implant is something that has been transferred and placed, from the outside into our body. That's what an implant is. And in this case, the purpose of an implant is actually to restore and to bring back a tooth that has been lost. So we all have two sets of teeth. We have our baby teeth, and then we have our adult teeth, our permanent teeth. But sometimes, we lost, well, for sure we lost the baby. I mean, some patients will
Yes.
still have the baby ones. But if we lose our adult teeth, then, it's very important to replace. And maybe we should start by saying why is important to replace the teeth. And I want to bring in the next coming series some photos of some cases on patients that they have tooth loss, and you can see how the bite has shifted, how the teeth have moved and sometimes have dropped and or come out of the arch. And that causes a lot of bite issues, causes a lot of interferences, causes trauma on the teeth, causes bone loss, causes tooth immobility, recession, and the list goes on and on.
Yeah.
And I would say that nowadays that we have such good techniques on periodontal disease and how to treat it, and we know how to treat decay, and there's new materials, new kind of crowns, and the aesthetics have come up to a very, very high level. And there's a lot that dentistry can do these days to restore, to give like an appearance of total normal tooth like, with the reflection of the light, with the shades. So there's a lot of technology these days that can help and do that. But the problem also resides not only on the top of the tooth, but when we have lost the tooth, we need something to support that crown, and that's what the implant does. And I see that there's a lot of confusion sometimes on what an implant is. Some patients call implants a bone graft because it's also something that's been placed in their body. But a bone graft is a material used to grow the bone, used to help the bone grow. Is used a lot with implants or before implants to make sure that the bone becomes ideal, right? So then we can go and place that implant in an ideal position without compromising. So that's what the bone graft is. But the implant itself is just an artificial root, and they're supposed to support a structure. Sometimes it might be just one tooth, one crown, and in order to do that, there's a couple of pieces that tie together to have that crown seated on that artificial root or that implant. But sometimes we have dentures, so we can hold dentures. And today I want to bring just quickly, I know that our sessions in the morning are fast because everybody's going to work and getting things done. But I'm just going to bring a case that illustrates, like what happened, and we'll talk a little bit about like the history of the case, and then how the case, was transferred, into health. So well, let's start with our before photo, and here we see a patient that, if you can see, is everybody seeing this?
So if
Yeah.
you guys are on TikTok, we do have our YouTube channel where we're streaming live on Instagram, on YouTube, on Facebook at Dr. Munné DDS. Is that right? The Facebook?
The Facebook is Ana M. Munné DDS
Ana M.
PA.
Munné DDS, and also on YouTube, where you can actually go there and see what we're talking about. For those who are connecting on TikTok, please make yourself route to or take a look at that later. We're going to, Dr. Munez is going to explain this morning.
Yeah, well, we have in the other platforms, a photo that we're displaying right now. And this is a case of a patient that had gum disease, periodontal disease. And we can see that there's very severe recession. There was tooth mobility. There was a gap in the front. The bite was off. The teeth are very flare forward. The patient was also a smoker. You can see that there's a lot of stain in the mouth. That was actually after, cleaning, the stain. I want to say something about the stain since we're talking about it,
Yes.
Patients think, well, a stain is not a big deal. And if you scratch it with a very aggressive toothpaste, it comes off, but that causes a scratch on the surface of the tooth and leaves the tooth very rough. And that's not good, because then it's easier to get stain. And actually, stain itself etches the tooth. It's like an acid, let's say, that etches. So when you remove it, it's not a smooth surface. So, the hygienist has to really, burnish that area, polish it to make sure that it becomes smooth, so things do not deposit. If things are rough, they stick better, right? So you don't want your teeth to be easy to stick, because you don't want bacteria, stain, all that to stick. You want a smooth, gliding surface, so things don't stick. So
Makes sense.
when you have a stain, it's easier to have a stain again, let's say, unless that you have a really good hygienist that can, smooth that out. But, a stain has a way to come back. And, of course, not only, cigarette smoking or pot smoking, can cause that, but it's also like, coffee, red wine, sodas, some food coloring. So there's like a variety of things that causes us to have stain. But in this case, there was mobility, there was a lot of pox, there was infection, the teeth were very sensitive to cold. The bite is, if you see the bite is at an angle, we call that a cant. And that means that the right side and the left side actually are at a slope. So in this case, there were some teeth that were non-salvageable. The two teeth that you can see on your right side on the bottom, and then the upper teeth, they all needed to come out because there was very little bone that was holding the teeth. So in this case, we did full mouth implants on the top. The teeth were removed. We built up the bone. We built up a lot of bone graft. We built up bone in the sinuses. So we were able to actually place 8 implants, and we got also like 2 implants on the lower left. And we're going to see now the photo after. So we can move to the after photo. And for those of you in TikTok, just go and watch the video again and you'll see. And in here you can see this is a case of a denture, because of course the patient had lost a lot of bone. And you can see that we reestablished a little bit the bite. The bite now is straight. We don't have like the left side higher than the right side. There's 2 implants on the lower left of the patient, which is actually on the right side of your screen. The last 2 teeth on the bottom right of your screen, those are dental implants. Those are single implants. They're not holding a denture, they're just holding a crown. So the patient can clean and floss, but look at how much better the tissues look at how pink and healthy they look, and after the patient has been treated. And then on the top, you can see a little bit of an implant on the upper left, but just you can see how the denture fits perfectly now, the smile, and how the denture is actually, easy to maintain. The patient now has healthy implants placed. The patient now knows how to take care of themselves. And of course, this is a successful treatment, because the success of the treatment is not like the day that we do the surgery, it's the patient being able to maintain that longevity on the treatment. So that's how we measure success. We do treatment on patients not just to get them implants in the mouth, but for them to be successful for a lifetime, for them to be able to eat and chew and know what to do to maintain. Because of course, there's a reason why, the periodontal disease, didn't get treated, and kept advancing, or didn't get treated the way that the patient needed. But from this point on, we want to make sure that there's not any additional dental disease, that we only see patients for maintenance, and that everything looks nice, and that everything, can be healthy for many years, and the patient feels confident and feels good about himself, and that we can make that a long lasting, experience.
Yes, correct, guys. Just want to thank you for tuning in to this interesting series about implants. Thank you for tuning in. And do not forget to look for more information about us. Go to our website, healthygums4, number 4, for all.com, to find more about the services and about questions you might have. And always remember to follow us on Instagram, Facebook, YouTube, and all the different, of course, and TikTok, all the different channels we start tuning in. We try to bring this live sessions every Friday. That's our goal. Sometimes we skip a Friday, but we are consistent with you, bringing you the best information so you can stay healthy, stay informed. And do not forget to leave your comments below about this topic or other future topics that you would like us to bring. Dr. Munné has all the wisdom in this. She's been doing it for a very good amount of time. So stay tuned. We'll see you guys at the next episode. And always remember to take care of your smile and stay informed.